Well, welcome everyone. My name is Jennifer Farmer, and on behalf of our project team, thank you so much for joining this webinar today. We are excited to share with you more information about iTP3's application for funding to support the development of innovative teen pregnancy prevention programs utilizing a systems approach. So let's go ahead and get started. The Innovative Teen Pregnancy Prevention Programs, or iTP3 as we often refer to it, is a project made possible through funding from the Office of Adolescent Health to promote and support the development of program-based teen pregnancy prevention innovations. This 5-year project is actually a joint collaboration at Texas A&M University between the Department of Health and Kinesiology, which is housed within our College of Education, and the Center for Community Health Development, which is housed within our Health Sciences Center, School of Public Health. We are currently in the second year of iTP3's overall project, and this application represents the second opportunity to apply for iTP3 funding. In May of 2016, the first cohort of iTP3 innovators began working on their funded projects. If you have not done so already, we encourage you to explore iTP3's website to learn more about these projects. And finally, before we proceed any further, I would like to provide the disclaimer that although funding for the iTP3 project has been provided by the Office of Adolescent Health, the contents of this presentation are solely the responsibility of Texas A&M University and do not necessarily represent the official views of the Department of Health and Human Services or the Office of Adolescent Health. So now that you have a little bit more background information about the funding supporting our project, I would like to introduce you to the rest of the iTP3 project team. Ken McElroy and Kelly Wilson are co-principal investigators for this project, and I will be serving as the program director. Whitney Garney is our evaluation director. Angie Alanis is our technical assistance director. Kat Kadenak is our communication coordinator. Kristen Garcia is our evaluation manager, and Christy Hayes and Jordan Nealon both serve as project liaisons. You can learn more about us by visiting our website. Okay, so now for the webinar objectives. During this presentation, we will review key dates and funding information as well as specific funding criteria, including innovative design strategies and approaches for preventing teen pregnancy, populations of interest, as well as eligibility based on a program's current stage of development. We are also going to discuss 4 specific expectations for funded innovators and how you can apply for funding. I want to point out that this presentation is designed to provide an overview and hopefully a little bit more clarity regarding information that is provided on our website within the application information section, as well as within our request for application document that is available for download from our website. Please make sure that you thoroughly read through this information before applying. By the end of this presentation, we hope you have a better understanding of our project and the application process, but we have reserved the last part of this presentation for any additional questions that you might have. Questions can be submitted using the chat box on your screen. You can also submit questions after this presentation online through our website, which is itp3.org, or by sending us an email. And our email address is itp3@tamhsc.edu. We will do our best to answer all of your questions today, but we anticipate that there might be some questions we don't have time to get to, as well as some that we might need time to discuss further as a group or with OAH before responding to. All of the questions and answers from today and others received in the future will be posted to our website under Frequently Asked Questions. Lastly, this webinar is being recorded, and a link to this recording will be posted on our website in the near future. So there are a few key dates that I would like to highlight. The first is letting us know you are planning to submit an application. We ask you to do this, if possible, by January 9th. You can find the intent to apply link under the Apply for Funding section on our website. This step asks for very little information, and it is not a requirement, but it will be very helpful for us when planning for the review process. The official due date for the iTP3 application is January 30th, and we plan to notify those who have been selected to receive funding by April 5th. Funded projects will officially begin on July 1st of 2017. We are also currently planning a 2- to 3-day workshop in May of 2017. While we have not identified the specific dates or location, the training will take place the week of May 22nd through the 25th, and even though we are currently in the application phase, we want to strongly encourage you to mark these dates on your calendar to ensure that 1 to 2 of your key project team members will be available to attend if selected for funding. Please note that you do not need to budget for travel expenses related to this training. Costs will be covered by iTP3 as this training will occur before your official project start date. You can find a written description of this information within the RFA as well as on our website under Funding Expectations. So through this funding opportunity, applicants can apply for up to $100,000 to support the development of their innovative teen pregnancy prevention program, and funding is available for 12 months. Indirect costs are built into this amount, so $100,000 is the maximum total amount an innovator will be awarded. Approximately 6 to 8 innovators will be selected to receive funding. Please note that this number comes from new applicants responding to this application as well as Cohort 1 iTP3 innovators who reapply for funding to continue the development of their current projects. And for those who might not be ready to submit an application this January, we do plan to release applications annually in December of 2017 and 2018. As we will discuss in a little bit more detail later in this webinar, applicants can actually apply for and receive funding across multiple years. Lastly, we want to point out that we welcome applicants from across the U.S. and from a variety of backgrounds. Preference will, however, naturally be assigned to those who have experience in developing innovative programs, interventions using system approaches, instructional and/or human-centered design, teen pregnancy prevention, sexual health promotion, and/or experience working with a program's target population. If you're unsure of your eligibility, you can find a detailed eligibility list on our website, or feel free to send us an email. We would also like to mention that we recognize that some of you might already have funding from the Office of Adolescent Health or from iTP3. If this is the case, you are still welcome to apply, but it must be to support the development of a different project. So now it's time to dive into what makes this funding opportunity so unique and exciting. As many of you already know, while we have continued to see a reduction in teen pregnancy rates, there is still room for improvement, especially for high-risk and vulnerable teens. In addition, although we have been incredibly fortunate to have federal funding available for the past several years to replicate evidence-based teen pregnancy prevention programs, there are limited programmatic options for some youth. Lastly, many of these programs follow a similar format. They are often curriculum-based and focused on change at the individual level. Considering all of these factors, iTP3 is looking for collaborative teams to develop teen pregnancy prevention programs using innovative design strategies and system-based approaches to impact high-risk populations. Our challenge to you is to be creative, be bold, and be new. We want you to think outside the box and submit something that is truly innovative. Now I'm going to pass this presentation to Kelly Wilson, a co-PI on this project, to tell you more about our interest in innovative design strategies.
In order to complement the planning and development of innovative programs, iTP3 is interested in collaborative teams developing teen pregnancy prevention programs using innovative design strategies. We believe design strategies can follow different approaches that have or will influence their development. In your proposal, we want you to identify how your program has or will utilize a systematic approach to innovative design thinking. If you are in the idea or program development stage, we are looking for your willingness to engage, learn from, and utilize design thinking principles offered during technical assistance opportunities. On this slide, I've included a couple of different approaches or frameworks that we have identified as innovative design strategies that can impact the program planning and development of adolescent health and teen pregnancy prevention. Systems thinking has been defined as an approach to problem solving that attempts to balance holistic thinking and reductionistic thinking. By taking an overall system as well as its parts into account, systems thinking is designed to avoid potentially contributing to further development of unintended consequences. There are many methods and approaches to systems thinking. Design thinking refers to design-specific cognitive activities that designers apply during the process of designing. Design thinking is a methodology which helps people understand and develop creative ways to solve a specific issue. Generally, we see it in business-oriented situations. And finally, human-centered design is a design and management framework that develops solutions to problems by involving the human perspective in all steps of the problem-solving process. Human involvement typically takes place in observing the problem within context, brainstorming, conceptualizing, developing, and implementing the solution. We look forward to seeing the variety of innovative design thinking approaches that are included in your applications. Now, Dr. Whitney Garney is going to talk about systems-based approaches.
Hi everyone, my name is Whitney and I'm going to describe a little bit more about what we mean by systems. So one of the primary purposes of our funding announcement is to create programs that address different levels of intervention. So we're asking the applicants to use innovative design strategies but also employ a systems-based approach. And we know that everyone interprets the systems-based approach differently, so I'm going to spend some time talking about what we mean by systems in iTP3. One good way to start thinking about systems is shown by the picture on this slide, which is a representation of a socio-ecological model. The idea behind this model is to focus attention both on the individual but also on their social and physical environment. Within the model, you can see that there's 5 different levels, and I'll refer to these levels as levels of intervention. They include individual, interpersonal, organizational, community, and policy. And the model assumes that by making changes within the social or physical environment, changes are also going to occur within individuals. So we consider interventions that address multiple levels of intervention as systems-based approaches. Within this model specifically, I've categorized the current 35 OAH evidence-based programs by the different levels of intervention. Several of the programs currently endorsed by OAH target multiple levels, so that's why you can see a total number that's listed on the left-hand side of your slide as more than 35. But from the illustration, you can see that over 65% of the current evidence-based programs are sexuality education and mainly target individual change. We have a couple programs that target interpersonal development using youth development or mentor-based approaches, and then even fewer that are targeting organizational change. Most of those interventions are focused on clinics. And so through iTP3, we're trying to move beyond the individual and the interpersonal targeted programs. We want applicants to consider the environmental context that's encouraging risk behaviors and decreasing access to contraception. So there's several reasons that we're taking this approach. First, a lot of individual level programs that we see do something that we call blaming the individual. So these programs assume that individuals are responsible for controlling all of the influence on their health, including their environment. So oftentimes we focus on individuals because while we know that there are other influences present, we think that they're simply out of our control or too difficult to address. Another implication of these individual level interventions are that they require a lot of resources. So when we look at sex education in school, we need funds to obtain the materials, we need funds to pay a teacher, and then we need continued funding over time to maintain the program. So we have to have resources be continually put into these types of programs for them to be sustained. So higher level interventions can help us overcome some of these concerns because they create mechanisms that indirectly influence adolescent health and are embedded within larger structures. So for further clarification, I wanted to describe 3 specific types of systems level interventions that we're interested in funding. And just as a disclaimer, these are not the only levels of intervention that you could address, but they provide you with an idea of what the higher level approaches are that we're interested in. And so I will stress that if you have an idea that is systems or ecologically driven that doesn't fit within these categories, that's okay. This is just an example. So the 3 types of interventions are called policy, systems, or environmental interventions, which is frequently referred to as PSD interventions. And it's important to note that these PSD interventions are inherently ecologically based because they are addressing larger levels of influence within organizations, communities, and institutional structures. So first we have policy, and these can be what we call big P policy that result in laws and regulations, which, by the way, you're not allowed to advocate for through this funding. or they can be little p policies, which you are allowed to have used in this funding announcement. And little p policies are the rules or ordinances within organizations. So one example of a potential policy change for teen pregnancy prevention could be within foster care systems. What if we had organizations put in place a policy that sent youth to youth-friendly healthcare providers during an intake process, and then during that visit they received contraceptive counseling? This would be an idea of a little p policy enacted within an organization. Next, we have systems. And systems are a little bit more difficult to understand because they can mean a lot of different things, and they can be big or small. At the most basic level, a systems change is something that impacts a set of things. That set of things can be a group of people, an organization, molecules, policy, an environment, and so on. So systems are simply defined by the boundaries that you place on them. One example of a systems change in teen pregnancy prevention is when a health clinic adopts a youth-friendly service model. So the model of care requires that, one, the providers are trained, but it also influences how the patients experience the intake process when they arrive. It also influences the way the clinic is advertised and how the public perceives it. So by adopting this model, the entire system of elements within this clinic or provider was affected. And then lastly, we have environmental changes. And I think these are the easiest strategy to understand, but one of the hardest to implement. So environmental changes are seen when we make modifications to the physical environment. And we see these very frequently within physical activity interventions when we build playgrounds or create bike paths or add lights to sidewalks and so on. But an example of how environmental change can be addressed in teen pregnancy prevention is creating a transportation system that can make it easier for teens to get to youth-friendly service providers, so the access is overcome. So these are just a couple options, along with a whole host of other things that we are interested in funding through the iTP3 project.
Thank you, Kelly and Whitney, for sharing a little bit more about our interest in innovative design strategy and system-based approaches for preventing teen pregnancy. In addition to these funding priorities, I also wanted to provide an overview of other program characteristics supported by the iTP3 project. In an effort to attract a diversity of innovations, we have placed as few limitations as possible on what iTP3 funding will support. The first important point to emphasize is that programs are not restricted to certain implementation settings. We believe that programs should be implemented in the setting or settings most appropriate for the focus of the program. In addition, iTP3 will also support programs targeting unique populations, including populations who are capable of influencing change for the adolescent target population. Populations of interest can be found on our website under application information as well as within our RFA. Lastly, we also support programs that incorporate technology as a support feature of the overall design. Regardless of your innovation's features, we want all programs to be safe, positive, supportive, and healthy for all who participate. We are specifically seeking programs designed to reduce pregnancy and other sexual health disparities that exist by age, race, geography, and among especially vulnerable populations. As mentioned earlier, a list of these populations of interest can be found within Appendix B of our RFA as well as the application information page of our website. But please note that you are not restricted in any way to this list. Regardless of the targeted populations, all applicants will need to provide detailed documentation regarding why the program is needed and how the program will strategically empathize, understand, and respond to unmet pregnancy prevention needs. For the reasons we discussed previously, the age range for an innovations program is not restricted as long as preventing teen pregnancy among a high-risk population is the program's ultimate focus. Lastly, I want to emphasize that we want a program's target population to be involved throughout all phases of development. To us, this is a critically important component of creating an effective program. Too often, target population involvement is an afterthought, if it even happens at all, especially when it comes to youth programs. We believe that partnering with youth throughout the development process is essential to building the next generation of evidence-based teen pregnancy prevention programs. So we're interested in working with innovators across all stages of program development. The easiest way for us to describe the spectrum of eligible programs is to separate program development into 4 stages. This begins with promising ideas that are ready to transition into a program, followed by preparing programs for implementation, then piloting programs and collecting data, and finally preparing programs for rigorous evaluation. This, however, is where our funding stops. We are actually unable to support rigorous program evaluation. Innovators will be expected to complete various program development activities throughout their funding year depending on where their program is in the development process. You can find a description of these expected activities on our website as well as within our request for application document, which is available for download from our website. Please know that you are not limited to only the activities we describe. We have only provided a few key activities that must be accomplished. We are also aware that programs might not fit neatly into one of these 4 stages, and we recognize that some programs might have reached their current stage without accomplishing all previous expected activities. In this case, innovators will be expected to complete such activities prior to advancing the development of their program. As a result, we would like applicants to consider where their program is in the development process, what activities have already been completed, and what activities are feasible to accomplish within the budgeted 12-month period. The time it takes to progress through these activities will be program specific. So we have not placed firm boundaries on what innovators should accomplish and do not expect a program to move through all 4 stages within one funding period. As I mentioned towards the beginning of this presentation, innovators can reapply for future funding to continue the development of their program. For example, an innovator who is awarded funding in response to this application for an innovative idea might accomplish enough activities to have their program ready for implementation. This innovator can then reapply for funding in response to next year's application, and they would receive an award to pilot test their program. This same innovator could even reapply for a 3rd time to receive funding to prepare for rigorous evaluation. So there are a few expectations associated with receiving iTP3 funding that we would like everyone to be aware of and consider during the application process. Our team is looking forward to partnering with innovators to identify capacity building assistance needs and preferred training formats. Capacity building assistance will be available for both the organization as it relates to the development of your program as well as specific to your innovation. The 2 to 3 day workshop mentioned previously is part of the CBA. The CBA-funded innovators will be expected to participate in, even though it is before the official project start date. In addition, innovators who receive funding to pilot their program will need to provide all program materials for review by our team as well as by OAH. OAH requires that all programs be medically accurate, complete, age-appropriate, as well as trauma-informed, culturally and linguistically appropriate, and inclusive of LGBTQ youth. Innovators will need to revise program materials based on this review prior to implementing their program. The 3rd funding expectation is that innovators will participate in a joint evaluation process. This will include submitting performance measures on a monthly basis and participating in evaluation activities related to their innovative program as well as the overall grant program. Lastly, innovators will need to obtain approval from an institutional review board if applicable. We will work closely with our institution's IRB to determine if IRB approval will be necessary for each program. So now that we have reviewed the specifics of what iTP3 funding will support, let's talk about the application process. To appeal to a broader range of applicants, 2 application formats are available to choose from. The first is an online application in which applicants will respond to questions individually through separate text boxes. And the second is a traditional request for application in which questions are answered in a narrative format and not restricted by text box boundaries. It is really important for me to emphasize here that the content requested through the questions does not differ between these 2 formats. It's only the method in which the applicant responds to these questions that differs. Both the online questions and the RFA are available for download on the website under our Apply for Funding section. We encourage applicants to explore both formats before starting the application process and then choose the one that works best for them. Although there are 2 options, an application should only be submitted using one of these formats. Online applications are submitted electronically within our website, and the applications submitted in response to the RFA will be submitted electronically as a PDF to the iTP3 email address. So regardless of format, applicants will respond to a series of questions related to how the program is innovative and why it is needed, the innovation design strategies that will be used, how the intervention incorporates an ecological or systems approach, who is the target population and how they have been involved or will be involved in the development process, and the potential for the program to make a significant impact on teams in the field of teen pregnancy prevention. We also want to know more of the specifics of your program's approach and design, including where you currently are in the development process and what activities have already been completed, proposed outcomes for the program's characteristics, as well as the development activities you propose to accomplish within the 12-month funding period. Applicants will also enter this information into a work plan template that is available for download on our website. In addition, there are questions to guide your description of how the project will be managed, challenges and risks associated with the project, partnerships and collaborations to support the project, and key personnel. Applicants should also complete a budget and budget narrative using the Excel template provided on our website. And lastly, appendices can be submitted in support of your application. So applications will be reviewed based on the content I broadly described on the previous slide, but you can find a detailed description of our review criteria on our website as well as within our RFA. We also want to emphasize that we know the level of detail an applicant can provide for each of the application components will vary based on the program's current stage of development, and this will be accounted for in the application review process. Okay, so now it's time for your questions. Please feel free to use the chat box located on your screen if you would like to ask your questions now. As a reminder, you can also submit your questions on our website or by email. Both of those are on your screen. And if you have a question related to a specific project or program idea, we encourage you to contact us through one of these options rather than asking them during today's presentation, as this kind of question will most likely take longer to answer. All questions and answers will be posted on our frequently asked questions page of the iTP3 website. Now we're going to take a look to see what questions we've received. So far, we have a few inquiries regarding availability of our PowerPoint, so we will make the slides as well as the recording of this today's presentation available through our website. And on that note, I would also encourage you to explore our website and see what previously recorded webinars are available. There is one specific webinar related to policy systems and environmental change that might be of interest to you, so I encourage you to check that out. In just a second here, we're going to take a look at other questions. So we have another question here. Does the 6 to 8 annual awards include, we just lost it there. 1 second, also include grant renewals? Yes, so this year we will be balancing the 6 to 8 funded innovative projects between those that respond to this application as well as current iTP3 innovators that choose to reapply for funding for another year. So we've got another question here. We currently partner with OAH Tier 1B, and we'd like to use technology to assist in recruitment and retention of programs. Is this something that would be a fit? So I'm going to encourage you to send us an email separately with a little bit more information, if you don't mind, related to that question, because I'm not sure if you're asking if it's going to be to support a current program that's already in implementation or not. But I will take this moment to stress that we really are looking for innovative programs themselves. So consider the specific details that are outlined within the application information section of our website, but please do email me with more specifics related to that question. Okay, so we've got another question here about how many applications do we normally receive. This is actually only our second year for applicants to apply for funding, but in response to the to that question, at least as it relates to year one, we received approximately 50 applications. Do we have a question here about what is the reporting system like after being awarded? I am assuming that this probably relates to reporting your performance measures, and we have a database that is set up that's very user-friendly, actually, for innovators to be able to submit information. Specific performance measures, that information we can try to provide more under frequently asked questions section of our website if you're looking for that specific information. Right, so now we have another question about budgeting here. It says regarding the range of $25,000 to $100,000, but what is the average amount you plan to award? This truly is a question that it really can't be answered, honestly, with one flat number, because each project actually can be quite different in what's proposed. We really just ask that innovators reflect on their specific project idea, what they can reasonably accomplish within 12 years based on the funding amount that they request. So if you've got more specific questions related to funding, I do encourage you to contact us afterwards. Okay, so we've got a great question that honestly I anticipated to come up at some point during today's question. This says, given the uncertainty surrounding the political environment, is TPP funding secure for this cycle? So this is an issue that both the Office of Adolescent Health as well as iTP3 and many that are working within the field of teen pregnancy definitely are aware of. Our particular project, as I mentioned earlier, we are a 2-tier A grantee, and as such, we are funded through a continuing resolution. We actually we'll have to wait until the end of April for legislators to make a final decision related to whether or not we will receive year 3 funding, which would be the funding that would support programs awarded through this particular round of applications. So we've been in very recent discussions with the Office of Adolescent Health and have been strongly encouraged to proceed with all planned activities specifically related to recruiting and selecting new applicants. However, it is important to note that ultimate decisions related to this continuing resolution will not be made until the end of April, which is actually after we intend on making the notifications of award related to this project. So, sorry.
We have a couple of questions coming up about reporting and basically how onerous is the reporting expectations for iTP3. Right now, our innovators are reporting updates on their work plans on a monthly basis. So if they have any changes to their work plan, then they report that to the team. Additionally, at the end, we will have a reporting expectation, but those are tying to products that were identified as being developed in the work plan for the most part, with a little bit of overview information. So from my experience with reporting, I do not believe that we have a hefty, onerous reporting expectation of our innovators. The big thing is that we have the database that Jed mentioned earlier that's reported to on a monthly basis, and that really ties to the performance measures that we are having to report to the Office of Adolescent Health, and that impact the month-to-month basis of our project.
This question was asking for examples of awardees that have used technology in their programs. So as we mentioned earlier, we welcome programs that incorporate technology as a supportive feature to their program. It would take a while to describe all of our innovative partners that we're working with right now, but I do encourage you to check out our website. We have an information sheet highlighting key characteristics about each of these projects through our website. There is one other project. If you are interested in exclusive technology supported projects, focused on preventing teen pregnancy. The other Tier 2A grantee is actually the National Campaign to Prevent Teen and Unplanned Pregnancy, and they do not have an application open this year. However, I believe they will be open again the following funding year, but they are looking to support technology-based teen pregnancy prevention programs, whereas iTP3 is focused on program-based teen pregnancy prevention programs.
We also have several questions in that are asking about differences between the cohort and related to the funding pool. And the funding pool that was described here includes the existing cohort and new innovators. But the application process is actually different. The RFA that is currently posted and that you will be responding to for new innovations will be looked at separately than the existing cohort.
Great. Okay, and we've got a question here about, we mentioned January 9th during the call as a due date. That actually is a date we're asking you to submit your intent to apply by. If possible, the intent to apply is a simple step that only asks for a little bit of information, and it does provide you with an option to give us a brief description of the program you plan to propose. However, this is not a requirement. It really is just a way to help us prepare for the application review process. So it is very much appreciated if you do submit. You can also submit it past January 9th. That is just our timeline that we would like people to submit it by. There's a question here about, is there a minimum number of participants to be served or a target range? Again, I think because there's so much flexibility in the level or the stage of development that our project will support, I think that that's going to be very specific to your particular program depending on where you are within the development process. We did mention earlier that we expect for the target population or populations, whoever you're working with, and that will be involved in the development of that project throughout all phases, but that will look different depending on what phase you're at. So I encourage you to send me another email if you've got additional questions for clarification. So we've got another question here about if we are currently receiving TPP funding from OAH, would we be able to receive iTP3 funding for additional work in our county? And yes, if you have funding really from any organization, but specifically OAH or iTP3, you can apply for funding through us, but we stress that it is going to be to support other development activities, so to support the development of a new program. Okay, we have one question here. What is the max indirect rate allowed?
So Texas A&M has a federally negotiated rate of 48.5%, so that will be the max rate for any innovative proposal that's submitted.
Okay.
And for those of you who have your own federally negotiated indirect rate, you can certainly use that for this proposal.
Okay, so we have a question here. How do we feel about current grantees applying for new projects through round 2 in addition to renewal application for their continuing project, round 1? I think the best way we can describe this is it's not in consideration of organization. We have tried to leave the organizations that could apply for funding wide open. It really relates to the projects being proposed. So if you our current iTP3 grantee, you're welcome to apply through this application as well as responding to the continuing application to support the development of your current project. We really are just seeking truly innovative ideas, and that's going to be what is reviewed and accounted for during that selection process. We have another budget-related question. Is there a match requirement? And the answer is no. Another budget-related question. Are there any restrictions on the budget covering new hire or staff time? And the answer is no. On that same note, if you intend to hire a project team member that's currently not employed by your organization, please make sure that you describe that position in full detail for us within the application. As I mentioned earlier, all funded applicants will actually go through a review process by our IRB, and that will be to determine if full review is going to be needed for your proposed activities. For this current year, all of our organizations ended up receiving went through the IRB review and approval process to conduct their activities. But specifically, the training that was referenced earlier is city training, CITI. And again, we'll put more information about this on our website under frequently asked questions. But that is a training that's required by our IRB, and while that is not necessarily a time-consuming training, it might be helpful to work on some of these things ahead of time if you have access to them. But stay tuned for more information on that. We'll share with you in the near future. So this question specifically asks if we can use funding for building capacity. And I think that's pretty open-ended question. So again, you might want to send us a follow-up email with more information, but absolutely, I think that we anticipate that the funding that is awarded will be used to support and provide capacity assistance for your project. But I do want to add on to that from the iTP3 project team, one of our key responsibilities for supporting our innovators is to identify capacity building assistance needs and then for us to respond to those. So I think that that's a big piece for, I think, thinking through your budget and potential costs and activities that will be there as your partner to respond and provide training and technical assistance as needed. Okay, so
there's a question about any expectations regarding organizational collaboration and partnerships, and the simple answer is no, there are no specific expectations. However, given that we are looking at really supporting approaches that advance what Whitney talked about, which is the systems-based approaches, we are looking for collaborators or partners that would really be able to support the systems-based work in the application, or even the innovation design if that's a key part of your proposal. So we're really looking for a team that is able to carry out the project as proposed. So enough information, enough expertise in teen pregnancy prevention, innovation design, and or systems-based approaches.
So this question says, what are the technical assistance opportunities you referred to in developing program and innovative design? So one specifically does relate to the May training that we mentioned earlier. Again, for those dates, you want to mark them on your calendar. They take place sometime between May 22nd and May 25th. But that will be an opportunity for us to really work with funded innovators to ensure that these are components that are woven into your overall program. The additional future training needs really will be project-specific or specific to our overall innovators based on the projects that are funded. So we work with innovators on a routine basis to make sure that we're considering any needs that have emerged as they continue through the development of their projects. So I don't have additional specific examples at this time to provide you, other than they will be made available in the future.
So we're getting more questions about specific locations of our current innovators because the snapshot that's provided doesn't necessarily identify a location specifically. And so there's questions about whether we have funded programs in specific states. And the one thing that we want to emphasize is we are really looking for innovative programs and also programs that integrate a systems-based approach and innovation design. And if we have 2 grantees in the same location, that's okay with us. We're not going to eliminate a proposal or not fund a proposal that meets the expectations that have been set forth because there's another high-quality application in the same geographic area.
So I was just going to acknowledge that we continue to receive several budget-related questions. I think the easiest thing is we'll add to the budget-related section of our frequently asked questions to provide answers to these. There's some great questions, and I recognize that they'll be very helpful for you when responding to the budget narrative component. So I know that we've not responded to all of those, but I do think it'll be easier for you to just reference that section in the near future. Okay, everybody, so I do think that we've answered all of them that have come through, except for the budget one that we just acknowledged. We will work to compile all of these questions and answers and add them to our website. And that, along with the recording of today's webinar and PDF version of today's slides, will all be made available through our website. And we can send out an email to all registered participants as soon as that information has been posted. So you don't have to go back and check it over and over again. But do be on the lookout for that, and don't hesitate at any time to submit questions through our website or by email. We're here to answer those for you. And let's see here. I think that I just want to say thank you for actually participating in today's webinar and taking time out of your day. And I encourage you to be creative, be bold, and be new in your ideas and what you propose. We are really looking forward to see what is submitted to us by the end of January. And we hope you have a wonderful rest of your day. Thank you for participating.